Welcome. This is a guide to the financing of one of the most important proposals in our state, the Washington Health Trust, known as Senate Bill 5233. We're going to cut through the complexity and look at a smarter, fairer way to pay for the health care every Washingtonian deserves. Let's start with the problem. We pay more for health care than any nation on earth, but a staggering amount of that money never reaches patients or doctors. It's lost to a maze of bureaucracy, insurance company profits, and a billing system so complex it would be comical if it weren't so costly. Think of it this way. Our current system is like a highway clogged with 50 different incompatible toll booth companies. Each has its own rules, its own bills, its own staff. The Washington Health Trust replaces them all with one simple, efficient electronic toll. The savings on all that redundant overhead is in the billions. The solution is unity. One unified system for all of Washington. This isn't just about care, it's about power. The collective power of 7.8 million people leveraged to create a better deal for every single one of us. This creates incredible security. Today, health insurance is like a series of small, risky potluck dinners. If someone at a small dinner gets very sick, the cost is devastating for that tiny group. The trust creates one massive statewide potluck. Everyone contributes something, and from that vast shared table, everyone can get what they need. Risk is shared so widely, it becomes manageable for all. Where do the billions in savings come from? First, we cut the waste, the profits, the marketing, the armies of people arguing over bills. Second, we use our new buying power. Right now, we shop for drugs and hospital care alone, paying retail. The trust shops for all of us, like the world's largest wholesale club, and negotiates a fair price. For you, this means an end to the mountain of bills. No more premiums, no more deductibles, no more co-pays at the doctor's office, no more financial panic from a surprise medical bill. Think of the change like this. Our current system is like a gym with a high monthly fee, plus a charge every time you use a machine, plus a huge upfront fee just to walk in. The Washington Health Trust is a simple, all-inclusive community center membership. One predictable contribution, and you have access to the care you need. So, what replaces all those old bills? A fair, transparent, 5-part financing model. Pillar 1, a smart employer contribution. The standard rate is 10.5% of payroll, replacing what businesses already pay for private insurance. Crucially, small businesses get significant discounts, as low as 4.5%. This ends the insurance headache for employers. Pillar 2, a small capped employee deduction. This is a maximum of 2% of your wages, and your employer can choose to pay it for you. This single 2% replaces every premium, deductible, and copay you face today. Pillar 3, support for the self-employed. They would contribute 2% of their net earnings, finally gaining affordable, comprehensive coverage. Pillar 4, asking the most to do a little more. The bill adds a modest 2% to the existing state capital gains tax, but only on gains over $300,000. It protects home sales, retirement accounts, and the vast majority of investors. Pillar 5, using what we already pay. Federal funds from Medicare and Medicaid are redirected into the trust. This isn't new money. It's our existing public investment, spent more wisely to cover everyone better. Let's compare. Right now, you face premiums, deductibles, co-pays, and surprise bills. With the trust, you have one simple contribution, capped at 2% of your wages for truly comprehensive care. More coverage, complete financial protection. The bill includes strong protections. It safeguards union-negotiated benefits during the transition, caps contributions so they're never higher than necessary, and has hardship programs for the smallest businesses. So, let's get to the absolute bottom line. What does the analysis tell us? The core finding is this: the total cost of the Washington Health Trust system is lower than what Washingtonians and our state are already spending right now. How is that possible? Because the massive savings from cutting insurance company profits and administrative waste, savings estimated between $5 and $13 billion every single year, more than offset the new public funding. For you and your family, the math is even clearer. You would pay a simple, predictable contribution, capped at just 2% of your wages, and that single payment replaces every premium, every deductible, and every copay you face today. The conclusion is inescapable. This is not a new cost. It's a smart investment that delivers more care, for more people, for less total money. That's the financially feasible future the Washington Health Trust offers. The verdict from independent analysis? This plan is feasible, fair, and forward-thinking. The massive savings from a streamlined system mean the new, fair contributions add up to less than what we currently waste, while guaranteeing care for all. You can help build this future. Contact your state senator and your state representative. Tell them you support the Washington Health Trust. Share this information and visit website to learn more and add your support.